Namaskar viewers, hello and welcome to our pre-budget series of Perspective. I'm Teena Jha. Over the last few days, we've been talking to experts about the sector-specific expectations ahead of the Union Budget, which Finance Minister Nirmala Sitharaman will present on the 23rd of July. Today, we will discuss what the healthcare sector anticipates from the Union Budget, which is the first one of the Modi 3.0 government. In its previous budget in 2023-24, the government had allocated 86,175 crore rupees to the Ministry of Health and Family Welfare, which was a hike of around 13% from the previous year. In terms of allocation, the budget for the Department of Health and Family Welfare has consistently grown over the years. So since 2012-13, when the allocation was just around 25,133 crore rupees, it grew significantly to 86,175 crore rupees in FY24. In the interim budget in February this year, the Finance Minister announced an overall health budget of 98,461 crore rupees, marking an increase of over 14% in nominal terms. The Finance Minister also announced plans for establishing additional medical colleges by utilizing the existing hospital infrastructures, aiming to address the shortage of healthcare professionals and meet the increasing demand for medical education in the country. Now, with the full budget following after a historic third term for the NDA, what are the expectations from the government towards further strengthening this critical sector? To talk about this, I have with me two distinguished guests. So let me begin the program by introducing them to you. I'm pleased to welcome Mr. C.K. Mishra, former Secretary, Ministry of Health and Family Welfare. Mr. Mishra, glad to have you with us on this edition of Perspective. Also pleased to welcome Dr. D.K. Gupta, Chairman and Managing Director, FELIX Healthcare Private Limited. Dr. Gupta, thank you for your time as well. Welcome to Sansad TV. Let me put in the first question to Mr. Mishra. Sir, when we hold a pre-budget discussion on any sector, the most obvious question is related to the allocation. What would you expect the government and Finance Minister's seventh straight budget, what would you expect her to allocate to the healthcare sector this time around? In the interim budget, the number was somewhere close to 98,000 crore rupees, sir.
I would say yes and no. The reason being that, as you mentioned, there has been a steady increase in the budget in terms of the total quantum of money that has been provided, one budget after the other. But if you look at the overall scenario after adjusting for inflation, the increase is not that significant. And the reason why it should be significant are twofold. First, we need to move towards our own commitment of the 2017 health policy of 2.5%. Second, this is a very critical sector. And what the pandemic has taught us is that if we are not strong with our health sector, we will lose lives. Right. Therefore, my expectation, and I guess it's the expectation of everyone, is that we need to see some kind of a quantum jump in health funding. I do realize the limitations that government has because they're competing interests, but health must find priority. Now, where does this priority go is another question, and that is to be determined by the way the health outlook presents itself and the way we approach, whether it is curative health, preventive promotive health, where do we put our money is a question we can discuss. But overall, I feel for both the public sector as well as the private sector, and I must emphasize here that health is not just government's business. While government must increase the budgetary support for health, the private sector needs to come forward in a big way and invest as well. So I feel there has been an increase, no doubt. It's been slow, not commensurate with the 2017 policy, and it's time to really allocate a much larger portion to the health ministry.
Certainly. So expectations are high, Dr. Gupta. As the budget approaches, the healthcare sector would expect a fair share. But looking at the constraints, as Mr. Mishra rightly said, it wouldn't. We can't expect a quantum jump. We've seen that gradually increase from 2012 to now. It looks like a huge increase, but the demand is also fairly higher for a country of 1.4 million people, pandemic or no pandemic. Healthcare is an extremely critical critical area and it requires that kind of budgetary support. In terms of expectations, what would you expect the finance minister to announce for the sector is the first question. The second, I'll come to you on the role of the private sector. What has been the role of the private sector in strengthening the healthcare system in the country for the moment?
Thank you, Teena. And I am in the line with that, Mr. C.K. Mishra, sir, that expenditure on the healthcare should be increased, and it is actually very less till now. If we talk about percentage of GDP expenditure on the budget, it is around 2.5%. And past 70 years during the Congress regime, it was 1.25% to 1.25% only. During the Modi regime, it has been doubled from 1.25 to 2.5. But definitely it is still less, because we have seen in the COVID pandemic that our infra is actually not able to sustain such type of pandemic. And definitely, as per WHO guidelines also, it should be around 5%. In BRICS countries, except India, everybody is spending around 5% of their GDP. Developed countries, they spend around 10 to 15% of their GDP on the healthcare. So I think there should be great jump in the expenditure from GDP. And I think there is a huge requirement, because health is a fundamental right also, and government is also quite clear and quite focused on healthcare, like, because they are actually implementing world's largest cashless scheme, that is PM-JAY, Ayushman Yojana, and that is quietly effective also and quite successful also. I think they have done several reforms in that scheme also. So we expect from the private sector, not from the point of private sector, from the point of general public, because health is a fundamental right. So I think that GDP expenditure of healthcare budget should be around 3.5% of the total GDP, and within the next 2 or 3 years, it should be minimum 5%. And talking about your second question, Teena, as the role of private healthcare sector in providing healthcare services to our general population, we know that our population is around 1.4 billion. And out of all the services provided to the general public, like outdoor treatment, indoor treatment, including quaternary and tertiary care services, 60% of the services are provided by the private sector only. Means the government is fully dependent, even public is dependent on the private healthcare sector for their essential healthcare services, including primary healthcare services. So that's why we need a strong private-public partnership with the government to provide services to tier 2 and tier 3 cities, because we know still 70% of the healthcare infrastructure is confined to tier 1 cities only. And however, our 70% of the population, Indian population, lives in the rural area, means tier 3 and tier 4 cities, the L1 and village level, where only we are struggling for the primary healthcare services also. So that's why if you want to promote healthcare that is accessible and affordable to tier 2 and tier 3 cities, definitely government should do some subsidy. They should promote private healthcare investment in these areas. For that, I think we know all that for setting a hospital, it is a high asset business. Means you need high capex also, you need high opex also. Means for establishing hospital, you need land, plant and machinery, that is a huge cost. Also for running hospital, you need high operational cost also, providing just like salaries of doctors and nurses and all other staff and other expenditure also.
Okay,
so for that, the incubation period means
Yes, go ahead. Please complete your point.
Yes, please. Yeah, so means for making a hospital profitable, it takes around 3 to 5 years from its inception. Means for at least for first 5 years, there should be good subsidies on the land allotment, on plant and machinery, GST-free services, import duty should be less, financial, there should be rate of interest subsidies in the funding of the hospitals also. We should promote private equity players to invest in the healthcare sector. So I think these all things has to be done by government to promote accessible and affordable healthcare in tier 2 and tier 3 cities.
Okay, I'll take on that aspect of accessibility and affordability. Mr. Mishra, you've been part of the government. Over the last few years, we've seen several efforts by the government to make healthcare accessible and affordable to the people of the country. So if you could just, for the benefit of our viewers, speak a bit about how successful have we been in implementation of these reforms. The second part being about, the private sector we've seen, they've not been particularly very keen on PM-JAY, on Ayushman Bharat. There was a lot of reluctance initially. So how do we ensure that going forth, more and more private hospitals open up to these schemes so that the question of accessibility is taken care of?
See, there are basically three pillars on which health is built: access, affordability, and quality.
Right.
This is what a patient deserves and should get. So if you look at the, let's say, last 20 years history, and largely with a lens on the National Health Mission, you would realize that access has increased. Almost every person, even in the rural area now, has access to some kind of a medical facility. Now, it's a matter of debate whether that is adequate or inadequate, but the access has been created. So we've created infrastructure. We've not been able to actually match it with the manpower that's required for this infrastructure. That is going on slowly. So to your question, access to a great extent has improved. Affordability, I'm afraid, has not kept pace with the way we have increased access. Now, there are many reasons for affordability not being there. What do you look at? You largely look at reducing the out-of-pocket expenditure. Now, out-of-pocket expenditure is a function of drugs and diagnostics to a great extent. So, how do we ensure that drugs and diagnostics do not account for a very large portion of the expenditure? And I'll come to this when I'm talking about the private sector, but for the time being, let me just say that we've not been able to address affordability to a great extent. Insurance is one way of reducing out-of-pocket expenditure, but one aspect that I would like to flag here is one way of reducing cost of medical care is preventive promotive health. The moment you go for care, the cost on medical care goes up.
Right.
Therefore, I would urge that we need to think very strongly on increasing our investment on primary health care, on preventive promotive health. If we are able to do that, perhaps we will save on our secondary and tertiary care in the health sector. Now, coming to your question on the private sector, it's a very complex one. You ask a patient, he'll say it's very expensive. You ask an administrator, he says we need to bring it down. You ask the private sector, they say the cost is so high that we cannot afford to bring it down. As Dr. Gupta was saying, the returns only come after 4 to 5 years. Therefore, I feel that private sector also needs to be supported. Now, why I say this is that with a population of like ours, it is almost impossible only to rely on public sector.
Right.
My prescription would be that public sector should focus more and more on primary health care, and the private sector contribute mostly in the secondary, tertiary care, which is where they are. Now, how do you reduce costs to make it affordable? We need to really get into details of the expenditures involved in the costing of care in the private sector, see what is hurting, perhaps a concession here, a concession there, to make sure that they also remain afloat, but the patient does not have to carry the burden. Therefore, I think this budget will do well. And I'm sure this thought process is on. Government has been thinking about it for a long time, and some actions have also been taken. We should support the private sector in a big way so that they are able to contribute to the overall health expenditure without really affecting the overall situation. We need to be real. As far as the PMJY part that you mentioned, hospitals have their own story, but I think slowly we are getting into a situation where the costs that the government has announced as reimbursement for the treatment will slowly go up, and there will be an equilibrium at some stage, but I think we need to focus on that.
Okay, Dr. Gupta, lots of complexities when we talk about this, partnership between the public system and the private system, and it's across various sectors. We would expect the private sector to play a huge role to ensure the kind of transformation that the Prime Minister keeps talking about. The important point is that a healthier country means a healthier workforce, and a healthier workforce would translate into the country's growth. So if India has to become a developed country by 2047, our healthcare systems have to be robust, and also we need to be resilient to the kind of pandemics or be prepared for situations like these, which might impact us in more ways than one. How do we plug in those gaps which currently exist in our healthcare system? I'll come to the research and innovation bit in just a bit, but for the moment, when we stick to the point of accessibility, affordability and quality, how do we plug the healthcare gaps which both the public and the private sector have to do in unison?
I think you're absolutely correct that we should have robust and resilient healthcare system, but definitely it should be quality healthcare system. As Mr. Sir told us, that quality is one of the pain area right now. Accessibility is there, but affordability is still lagging for some places. But definitely quality is not present, at least most of the places where we are providing quality healthcare services. So for focusing on quality healthcare services, I think government and private sector both should focus on lots of accreditation, certification, so that there should be education and awareness among the hospital staff to provide quality healthcare services. There should be some motivation, there should be some inspiration to be on this line of quality healthcare services. One thing. Second thing, there are lots of gaps between providing healthcare services to tier 2 and tier 3 cities or rural areas, where technology can play a huge role. Like there are telemedicine. Still, we are not using 1% of telemedicine services right now in India. During pandemic, definitely there was a huge jump, but now again it is just slowed down. There is steep slowdown. For that, I think technology enablement of the hospital, especially tier 3 and tier 2 cities, so that we can provide all primary healthcare services, secondary healthcare services, even tertiary healthcare service can be provided to the telemedicine. Even telemedicine, we can control the ICUs also in different departments or different hospitals. So that is one thing. Second thing, I think definitely the nursing and the doctors shortage is one of the challenge for private and public sector both, and other paramedical staff. For that, we need skilled medical and paramedical staff, or for that, there should be lots of medical colleges, nursing colleges, skilled institutions, and at their level also, the quality of education should be controlled. I think there are lots of nursing colleges in India, but quality of nursing care is not good in different hospitals, especially even in tier 1, we are struggling to find a quality nursing care or quality nursing care staff or paramedical staff. So I think skilled paramedical institutes should be there, and we should focus on the quality of medical education on these institutes. And definitely all these things can happen where there is a will of government, there is a political will.
You're right. And we saw some of those announcements by the finance minister during the interim budget in February this year. Even though it wasn't a full budget, the government did go on to announce some significant policy measures, the opening of, as you said, particular attention to the medical education. So we would expect continuity on that front as well. But Mr. Mishra, one of the demands that I was going through and which has been in vogue of late related to the health sector is from the middle class. The middle class expects that you have a Ayushman Bharat kind of a scheme which caters to this important chunk of the population as well. They believe they've been left out. The Ayushman Bharat currently caters to a particular population, but does not cater to the middle income families. Do you think, is it feasible for the government to accommodate that demand of the middle class?
See, when Ayushman Bharat was conceived, way back when we started the process in 2017, 18, this was the first phase where we took these, I think, if I remember correctly, 8 crore families and started. Now, it will slowly grow. But my point is that a scheme like Ayushman Bharat first needs to stabilize. The rough edges need to be smoothened before we can jump to more population. Just including more without the facility that can actually take care of the health to me, does not make much sense. We need to first create that infrastructure in both private and public, and then slowly include them. We also, as a country, need to think seriously now on what kind of insurance mechanism we want for treatment in the private sector for the middle class people. And for that, I think there are many interventions going on by government right now. The regulatory authorities have spoken on this on several occasions. But to me, one of the biggest benefits to the middle class will come if these insurance schemes are implemented properly and honestly at the hospital level. We also need to create quality hospitals in the public sector so that this middle class that you are talking about can access health there. There seems to be a feeling that there is no place for them there, which is wrong. We need to upgrade our quality and standard to a level where everybody would like to go to a public facility.
Right.
We need to invest for that, and that is where the budget will come in. We need to invest in infrastructure in a very wise kind of a way to ensure that why are people talking about the private sector providing better care than public sector? That should not be the case. To be very honest, in terms of the quality of manpower that we have, it's the same all over.
Right.
It's just a question of the infrastructure and facility which we need to improve slowly in the public sector.
So, since we're talking about how we need to upgrade our infrastructure, train our workforce in the medical sector accordingly, the question that I want to ask you is, and as the numbers say since 2012, so more than a decade, we are seeing the numbers, the allocation numbers are going up, but where is this money going to? So since you've served in the government as well, if for the benefit of our viewers, you could help us understand, we understand that the Department of Health and Family Welfare has two critical departments, the Department of Health and Family Welfare and Department of Health Research. What is the proportion of the allocation to each of these departments? Where exactly does this allocation go? How much money is given to the National Health Mission, which perhaps is the largest such mission in the world today?
And also the most successful, by the way.
Yes.
Having said that, naturally, much larger pie of the cake goes to the Ministry of Health and Family Welfare, and a smaller pie goes to the Department of Health Research. Within the Department of Health and Family Welfare, a large chunk goes to the National Health Mission. Now, National Health Mission within itself has encompassed huge amount of things. People think it's only about the primary health care and, the PSCs and CSCs that we have. It's not. It's about disease control. It's about all kinds of, eliminations that we are doing. It's about immunization. All that money goes to National Health Mission. Then you have money from the Parliamentary Swasthya Suraksha Yojana, the infrastructure building, the PMJY. All these constitute the total pie of the health ministry. Since you have asked this question, my suggestion in this would be that we need to increase allocation continuously and in a fairly large share on the National Health Mission.
Right.
Now, National Health Mission, the reason why I say this is, this has been one of the most successful experiments that we have made.
Yes.
It's established fact. It is this program which helped us bring down the maternal mortality, the infant mortality, and all the indicators of health. But where we are not being able to be successful today is disease control and disease elimination. We need to focus on that. For that, we will need far better infrastructure than we have today. Please remember that majority of this money goes to the state governments. Because health being a state subject, they are the implementing agency. You are only looking at the health budget of the central government. The states have a huge budget as well.
Right.
Unfortunately, majority of the health budget of the states goes on salaries and establishment. So the point I'm trying to make is While the state governments are taking of the care of the salaries and establishments, the central government needs to push in more and more funds towards infrastructure creation, human resource creation. Now, Dr. Gupta was talking about more medical colleges, and you also mentioned that the finance minister has announced this. This has to be a continuous process. We are very badly off as far as the population to doctor or population to nursing care ratio is concerned. We need to correct that. Having said that, I would still emphasize that immunizing children, saving lives, removing the current diseases that are prevalent in India should form a priority. If we have a basic healthy child and a basic healthy population, the cost per child on treatment later on is going to be greatly reduced. So we must focus on that.
Certainly. So the need of the hour is focus on increased expenditure on infrastructure, on the workforce in this sector as well. Another critical area, Dr. Gupta, that I would like to touch upon with you is research and development. R&D is one area which is critical to the growth of every sector, but particularly in health, we've seen how it's a long procedure. Sometimes the success rate isn't as you would expect it to be. And therein, we expect the private players, private sector to play a huge role. What are the kind of expectations that you have from the government this time on R&D? And majorly, how can the private sector also play a huge role in fostering innovation in the healthcare sector in India? Dr. Gupta, that question is please.
I think one point is very important here. I would like to reiterate that most of our budget goes to the curative part. We have very less amount of percentage investing on the preventive and predictive part, and even on palliative care also.
How much are we, spending on R&D currently? What is the need of the hour alongside the infrastructure, alongside the focus on the doctors and nurses and their training? How how important is R&D going to be to have a robust healthcare system that we want to achieve?
Very critical. Very critical, because if you have a brilliant manpower and no drugs and diagnostics and latest research to back it, you will find it difficult to do curative health. Therefore, it has to be high. If you ask me honestly, not just health, but the overall focus in India on R&D has been low, both in the public as well as the private sector, and so is it for the health sector. I must commend the work being done by ICMR and other such institutions which have invested a lot of money in getting results out of their research and development. But we as a country have not been able to come up with newer things, which is India's. Therefore, continuously the government must provide more and more for R&D. Even if you have the best infrastructure, the best manpower, if this leg does not stand on its own, I don't think you are stable. Right. And a healthy population is a basic requirement. I see no reason why we should not go out of our way to be investing more in it.
Right. So we are going the right way. What we are seeing is in every year there is an attempt to put in more money into the health sector, and so that all of the healthcare gaps that exist, there should be efforts to fill in those and plug in those gaps. But as both our guests have rightly said, for a huge population of 1.4 billion people, it's important that it be a continuous process. So the infrastructure, the workforce in the healthcare industry, their training, and at the same time R&D, these are critical areas on which every year there has to be adequate attention that has to be paid to on part of the central government, but at the same time it's states subject, so the states also have to ensure that kind of attention alongside the private sector as well, which has to collaborate and ensure that the robust healthcare system that we are talking about, that we are discussing about today, becomes a reality. So we hope, and there are huge expectations of the healthcare industry from Finance Minister Nirmala Sitharaman. Let's see what allocations she actually does for the healthcare sector on the 23rd of July, and the newer policies, newer announcements also as far as the healthcare sector is concerned. But for now, we'll have to wrap up the program. Thank you once again to both our guests for joining us on this edition of Perspective, sharing your thoughts, your views with us and our viewers. And to you viewers, thank you very much for your time as well.
watch more programs of Sansad TV, subscribe to our YouTube channel and don't forget to like and share them.